Before starting amivantamab, make sure to read the patient information leaflet provided by your pharmacist. This medication is administered by a healthcare professional through an injection into a vein. Typically, it is given once a week for the first 4 weeks, and then once every 2 weeks. The first dose is usually split over 2 days, and the dosage is determined by your medical condition, weight, and response to treatment. Your doctor may also prescribe other medications, such as acetaminophen, diphenhydramine, and dexamethasone, to minimize the risk of side effects. It is important to follow your doctor's instructions for all medications. While receiving the medication, you may experience infusion reactions. If you have symptoms such as nausea, vomiting, fever, chills, flushing, shortness of breath, chest pain, or dizziness, it is crucial to inform your doctor immediately. If you experience dry skin, tiredness, muscle or joint pain, nausea, vomiting, diarrhea, constipation, mouth sores, abdominal pain, decreased appetite, headache, or dizziness while taking Rybrevant, make sure to tell your doctor or pharmacist right away. It's important to note that your doctor has prescribed this medication because they believe the benefits outweigh the potential risks. Your doctor will closely monitor you to minimize any risk. Be sure to contact your doctor immediately if you experience any serious side effects such as signs of lung disease, changes in vision, swelling in the hands, feet, or ankles, numbness or tingling in the arms or legs, or any unusual redness, swelling, or pain, as these could be signs of a severe allergic reaction. Rybrevant may cause a mild rash, but if you develop any rash, it's crucial to seek medical help right away as it could be a sign of a serious allergic reaction. Although very rare, if you notice symptoms of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing, seek immediate medical help. Remember that this is not a complete list of potential side effects, so if you experience any other effects, contact your doctor or pharmacist. And if you're in the US, you can call your doctor for medical advice about side effects or report them to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can call your doctor for medical advice about side effects or report them to Health Canada at 1-866-234-2345. Before starting amivantamab, make sure to inform your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your healthcare provider. Let your doctor or pharmacist know about your medical history before using this medication. Be cautious about activities that require alertness, as this drug may cause dizziness. Avoid alcohol or marijuana, as they can increase dizziness. It's important to limit alcoholic beverages and talk to your doctor if you're using marijuana. Using this medication may make you more sensitive to the sun. It's recommended to limit sun exposure while taking this medication and for 2 months after treatment ends. Avoid tanning booths and sun lamps, and make sure to use sunscreen and wear protective clothing when outdoors. If you experience sunburn or skin blisters/redness, notify your doctor right away. Before undergoing surgery, inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to discuss this with your doctor. Pregnancy should be avoided while using amivantamab, as it may harm an unborn baby. Your doctor will likely order a pregnancy test before starting this medication, and reliable forms of birth control should be discussed and used while taking this medication and for 3 months after the last dose. If you become pregnant, talk to your doctor about the risks and benefits of continuing this medication. It is not recommended to breastfeed while using this drug and for 3 months after treatment ends, due to the potential risk to the infant. Consult your doctor before breastfeeding. If you have any questions or concerns about taking this medication, consult your pharmacist or physician. When taking Rybrevant 50 mg per milliliter intravenous solution, it's important to be aware of any potential drug interactions that could affect its effectiveness or increase the risk of serious side effects. Make sure to keep a list of all the medications and herbal products you are using and share it with your doctor and pharmacist. It's crucial to have your doctor's approval before starting, stopping, or changing the dosage of any medicines. This will help ensure that you are taking Rybrevant safely and effectively. If someone takes too much Rybrevant and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center. It's important to act quickly in case of an overdose. Be sure to have regular lab and medical tests while taking Rybrevant. This may include tests for kidney and liver function, blood mineral levels, and blood glucose levels. It is important to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Rybrevant as prescribed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to arrange a new dosing schedule. This medication is administered in a hospital or clinic and is not intended for at-home storage. It is important to follow the healthcare provider's instructions for proper administration. Rybrevant 50 mg per milliliter intravenous solution Antineoplastic is used to treat certain types of cancer by inhibiting specific receptors in the body. The dosage and administration schedule will be determined by a healthcare professional based on the individual's medical condition. It is important to follow the prescribed dosage and schedule for optimal results. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.